Imagine holding a bowling ball on a pool stick. If you hold that pool stick straight up and down, it's pretty easy to hold. The more you bend it forward, the harder it becomes to hold. In this analogy, the bowling ball is your head, the pool stick is your neck, and your hands are the base of your neck and the top of your thoracic spine. If you look down at your phone all day and hold that pool stick forward, there's going to be a lot of tension at the base of your neck throughout the day. This is what we call tech neck posture. There's a muscle in the back of the spine that starts at the scapula and goes up to the base of the skull. When this muscle is in a tightened state for a prolonged period of time, it can lead to things like severe neck pain, it can lead to premature degeneration of the cervical spine, and it could also lead to headaches. Oftentimes we see the headaches wrap around the ear in like a ram horn type presentation. It's a very common presentation for tech neck. So today we're going to show you how we diagnose and treat tech neck here in our office. Okay, we're going to show you the two most common diagnostic tests that we use to determine the severity of a tech neck injury. The first is called the distraction test. We're actually going to pull up on the patient's head, and if there's pain during this motion, it'll indicate ligamentous injury, and relief during this motion indicates compression in the joints. The second test is called an axial compression test. We're going to push down on the patient's head, and that'll help us determine if there's injury to what we call the facet joint, the joint in the back of the spine. Any pain when or relief when I pull up like this?
Relief.
So relief there indicates that we're pulling the joints apart, so relief indicates a underlying compression issue. So now we're just going to confirm that with the compression test. Any pain or discomfort here?
Relief.
No pain. How about here?
Slight pain.
Slight discomfort. How about here?
Slight discomfort.
So as I'm pushing down on the patient's head, we're compressing the joints in the back of the spine. So we can see when we turned his head to the right, he felt a little bit of pain. Same thing to the left. That'll indicate some joint compression, which is pretty easily addressed with the adjustment. Okay, so now we're going to treat for the tech neck type posture. So what we're going to do is we're going to attack that levator scapulae muscle that we talked about earlier, and we're also going to attack some of the other muscles like the trapezius, and finally we'll adjust the top of the cervical spine because that's usually the area that's usually fixated during these types of presentations. So we're going to stretch your trapezius muscle first, so turn your head to the left, let your head fall into my hands, great. I'm just going to stretch you here. Should feel a good stretch that way. Shrug your shoulder up into my hands with about 30% of your strength. Good, and relax, good. Excellent, so that's a stretch for the trapezius. Nice and relaxed, let your head fall into my hands, beautiful. And then we'll address that levator scapulae muscle. Go ahead and push into my hands, 30% of your strength. Beautiful, and relax, good. So we'll do this bilaterally on the patient. After we're done stretching them, we'll make sure we get a nice adjustment. Nice and relaxed for me. Good. Give me the whole weight of your head into my hands. Beautiful. All right, guys, here's a quick stretch you could do to open up your shoulders if you've been sitting at your computer chair all day, hunched over at a laptop or something. So you're just going to clasp your hands behind your back. Nice, strong core. Squeeze like someone's about to punch you in the stomach. Feet shoulder width apart. Nice athletic stance. Reach out behind you. Bend forward, hinge at the hips, and reach for the ceiling, okay? Notice that I'm not bending forward at the back, right? I'm hinging at the hips. Hinge at the hips, reach to the sky. This is a great stretch to open up your shoulders if you don't suffer from low back pain. If you do happen to suffer from low back pain, we're gonna show you another stretch that you can do to stretch out and open up your shoulders. This is a great stretch you could do to help combat that tech neck posture. And you can do it right at your computer chair. So you're just gonna grab your chair with your right arm, turn your head to the left, bring your nose to your left bicep, and your left hand right to the back of your head. And then you're just gonna do a nice slight tug with your left hand. And your right hand is just bracing, not pulling. You should feel a nice stretch right over your right shoulder. So always stretch bilaterally, grab with your left hand. Nice slight tug with the hand that's on your head.